Hello everyone, welcome back to my channel. Today our topic is antipsychotics. Before moving on to the antipsychotics, let's see what is the main disease that use antipsychotics. Schizophrenia. Schizophrenia is a particular type of psychosis that characterized by delusions, hallucinations, thinking or speech disturbances. This is often initially affects people during late adolescence or early adulthood. Let's move on to the antipsychotics. Antipsychotics can be divided into two generations, first generation and second generation. This indication is not to indicate this classification is not to indicate the drug's clinical effectiveness, but they are rather to indicate their affinity for the dopamine D2 receptor, which in turn influence the adverse effect profile of the drug. First generation drugs, also known as the typical drugs, can be divided into low potency drugs and high potency drugs. Second generation drugs, also known as atypical drugs, are aripiprazole, clozapine, olanzapine. These have fewer extrapyramidal symptoms but high risk of metabolic side effects such as diabetic, weight gain, and all. First generation low potency drugs are clopramazine, and high potency drugs are haloperidol like drugs. Low potency means it binds weakly to the D2 receptor. High potency means it binds tightly to dopaminergic receptors. Let's move on to the mechanism of action of antipsychotics. There can be two mechanisms of action. First is dopamine receptor blocking activity in the brain. This mechanism of action in all of the first generation and most of the second generation antipsychotic drugs that blocks dopamine receptors in the brain and the periphery as well. Second mechanism of action is serotonin receptor blocking activity in the brain. Most of the second generation agents appear to exert part of their unique action through inhibition of serotonin receptor, normally we call as 5-HT, particularly 5-HT2A receptors. Actions of antipsychotics. Obviously, it causes antipsychotic action, extrapyramidal effect, antiemetics, anticholinergic, and other effects. Antipsychotic effect. When we're talking about the antipsychotic effect, all of the antipsychotic drugs can reduce the hallucination and delusion associated with schizophrenia by blocking dopamine receptor in the metabolic system of the brain. Second one is extrapyramidal effects. There are three main extrapyramidal symptoms as dystonia, akathisia, and tardive dyskinesia. Dystonia means sustained contraction of muscle that leads to twisting and postures. Second one is akathisia, which is motor restlessness. And third one is tardive dyskinesia, involuntary movement of tongue, lips, and necks. Third one is antiemetic effect. Most of the antipsychotic drugs have antiemetic effect that are mediated by blocking D2 dopaminergic receptors. Dopaminergic receptors of the chemotherapy trigger zone actually that cause antiemetic effect. Fourth one is anticholinergic effect. Particularly drugs like olanzapine produce anticholinergic effect such as blurred vision and dry mouth. Other actions can be hypertension, lightheadedness, altered temperature, and all. Let's see what are the cautions and contraindications that we should be aware when we are using antipsychotics. First one is alcohol. Because acute agitation accompanying withdrawal from alcohol or other drugs may be aggravated by antipsychotics. Withdrawal of alcohol or other drugs may be aggravated by using the antipsychotics. Second one is seizure threshold. All the antipsychotics may lower the seizure threshold. Seizure should use antipsychotic cautiously. That's all for antipsychotics.